Hello, my name is Paula. I'm going to be your student nurse today. Can I get your name and date of birth, please? Do you have any allergies? Are you on any medications? From a scale of 0 to 10, with 0 meaning no pain and 10 meaning the worst pain you've ever felt, what's your pain level? Do you have any cultural or religious intolerance? Have you noticed any abdominal pain? And what are your goals of care today? How often would you say that you... Now I'm going to ask you some questions about your medical changes in your bowel movement. Have you had any pain or... How often would you say that you have bowel movements? Any recent changes in your bowel movement? Have you had any pain or difficulty urinating? Any genital discharge? Any back pain? Are you sexually active? And now I'm going to have the client void before continuing this assessment, and we're going to note the color, the odor, and the turbidity. Now I'm going to start with inspection. I'm going to place the client supine with the knee slightly flexed. And I'm going to come to the right side, stoop a little bit, push my head above the abdomen, and now I'm going to note for the symmetry, the contour, and the size. And now I'm going to have the client tilt the head back, and then I'm going to report the abdominal bulges. And now I'm looking at the umbilicus, making sure it's midline to the abdomen, and I'm noting for any discoloration, inverting with ascites, and inflammation. And now I'm going to look at the skin of the abdomen, noting for any lesions, scars, striae, any superficial veins. And if abdominal distension were to occur, I would measure with a tape measure from the umbilicus up to hair distribution. And I'm looking at the abdominal movements. And now I'm going to start with I'm going to continue with auscultation. I'm going to use the diaphragm. I'm going to start from the right lower quadrant in multiple areas. And to the right upper quadrant. Also listening in multiple areas. And then the left upper quadrant. And now the left lower quadrant. So vowel sounds are loudest and more frequent right after a person eats and 5 to 6 hours after they eat. And so the normal sounds would be like 5 to 15 seconds, so 5 to 30 times per minute. Then hyperactive sound would be every 2 to 3 seconds, and which would be more than 30 per minute. And hypoactive sounds would be less than 5 sounds per minute. And an absent sound, if I didn't hear any vowel sounds, then I will listen for 5 minutes before I conclude that it's absent. And now I'm going to listen with the bell for Bruits. I'm going to start with the aorta, which is an epigastric region. And then I move on to the left renal artery, And I'm going to listen on both sides with you. So I'm going to listen to the left renal artery and then the right. And now the iliac artery. Again, on both sides. And then the femoral artery. There should be no Bruit's heard. That would be abnormal, probably. So after auscultation, I'm going to percuss. So I'm going to start with indirect percussion. I'm going to first percuss in all four quadrants, starting from the right upper quadrant, then to the left upper quadrant, the left lower quadrant, and then the right lower quadrant. So after lightly percussing, then I would use a fist percussion. Percussion, if there were any kidney or urinary tract concerns. And now we're going to move on to palpation. So I'm going to palpate starting muscle guarding. This is the light palpation, and it's going to be a little bit like a centimeter. So I'm going to start from the right upper quadrant, looking for any tenderness, rigidity, muscle guarding, and masses. It's going to be the right upper quadrant, the left upper quadrant, the left lower quadrant, and then the right lower quadrant. After light palpation, then I'm going to start with deep palpation. Again, from the right upper quadrant. The deep palpations are moved about 5 to 8 centimeters. So I'm going to go, again, looking for any tenderness, muscle guarding, rigidity, masses. And now I'm going to palpate the liver. Rebound tenderness in each quadrant. Depalpation of the liver is usually used to look for any masses, and patient is utilized for organs and masses, and is usually done by a practitioner. After depalpation, now I'm going to palpate the liver. Have the client inhale and exhale, and when exhaling, I'm going to press upward to fill the liver. So deep palpation is utilized for organs and masses, and is usually done by a practitioner. After deep palpation, now I'm going to palpate the liver. To palpate the liver, I'm going to place my left hand under the client's back, and with my right hand, I'm going to go in the mid-clavicular line, parallel to the costal margin, and I'm going to have the client inhale and exhale, and when they exhale, I'm going to press upward with my four fingers. And now I'm going to palpate the spleen. Place my left hand on the costal vertebral angle on the left side. With my right hand, I'm going to press inward on the costal margin of the right side and the left upper quadrant. And I'm going to have the client exhale, and I'm going to press upward or inward. The spleen should not be able to be felt. It's going to have to be 3 times as big as it's normally, as the normal size, in order for it to be felt. So that would be an abnormal finding. Place the client in a comfortable position. And then, do you have any questions for me before I go? Okay, so here's the call bell. Press it if you need anything.